Dorado
Here.
and Commissioner Christian.
Present.
I will read the land acknowledgement.
Thank you.
The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the February 21st, 2023 minutes.
I so move approval.
I second.
There's somebody on the comment line. Let me just check in. A person on the line, if you'd like to make comment, please press *3. We're on item 2, the minutes. All right, no comments. So commissioners, you can, we're going back to the old-fashioned way where we have to say everyone in favor, say aye. All right.
Aye.
Aye.
Oh, no. Okay, great. And then we can move on to the draft of fiscal year 21-22 DPH annual report. I'm pulling up the report.
Perfect.
1 second. And just let me know when you want to go to the next slide.
Okay, perfect. Is this okay? Okay,
Yeah.
great.
Yes.
Thank you. Okay. Can I? Good afternoon, commissioners. My name is Michelle. Good afternoon. My name is Michelle Coe, and I'm a health program planner with the Office of Policy and Planning. I'm joined today by my colleague Max Guerra, Senior Health Program Planner at OPP. I'm here to present the department's draft annual report for fiscal year 2021 to 2022. As you're aware, the annual report is required by the City Administrative Code, and the report gives a general summary of DPH's accomplishments over the past fiscal year. This year's report has a revised design using larger font, brighter colors, and columns to help improve the report's readability. Next slide, please. The annual report opens with a welcome and message from our Director of Health, Dr. Grant Colfax. This message is still under development, but it will be included in the report before the full Health Commission meeting on May 2nd. Next slide, please. The Director's message is followed by a message from Commission President Bernal. His message also discusses the DPH's response to the COVID pandemic, the Laguna Honda Hospital recertification, and the renovation of the Maxine Health Center. Both these messages provide our leadership's introduction to the department's activities discussed in the report. Next slide, please. The next set of sections provides an overview of the functions and services across the department. The sections start by introducing the department's 2 divisions and their roles in protecting and promoting the health of San Franciscans. The next section reviews DPH's True North and its 6 true pillars, which is then followed by the most recent organizational chart. As part of the Racial Equity Action Plan, this year's report presents demographic information on both the health commissioners and senior leadership. This data will continue to be collected and presented in the annual report each year. Next slide, please. The last introductory section focuses on the Health Commission. The section provides an overview of the structure and function of the commission, along with individual bios for each commissioner. Next slide, please. The next section of the report presents 3 feature stories that highlight some of the highest profile efforts by the department in the fiscal year. The first feature provides an overview of the COVID transition. This feature describes how DPH entered a new stage of the pandemic response as the city reopened. It also provides highlights of our 1-year anniversary of vaccinations. For example, by the end of 2021, the city reached a new milestone with 80% of the total population fully vaccinated. The second feature discusses efforts to expand residential care and treatment. This feature includes the opening of 2 facilities in 2022, Soma Rise and the Minna Project. The last feature provides an update from the Office of Health Equity and Human Resources. DPH continued to prioritize racial equity through the department-wide Racial Equity Action Plan. In May 2022, the Office of Health Equity released its first annual equity report. Next slide, please. Following the features are 21 highlights showcasing work across the Population Health Division and the San Francisco Health Network. The highlights speak to the tremendous work across the department in areas such as healthcare services, overdose prevention, whole person integrated care, HIV services, as well as within ZSFG, the Population Health Division, and Central Administration. I want to give a huge thank you to DPH staff for their support in drafting these highlights. Next slide, please. The next major section of the report focuses on data, starting with DPH's budget. Budget data provides information on expenditures, revenue, and major investments. For example, $123.6 million was allocated to continue DPH's COVID response. The next data section highlights San Francisco Health Network data on visits, patient demographics, and payer type across the major systems of care. One highlight of this section is that improved reporting methodologies have resulted in a more accurate representation of whole person integrated care data in the report. Lastly, each of the Health Commission resolutions adopted in 2021 and 2022 are included. Next slide, please. The report ends with an overview of the department's service sites and contractors. The maps of the primary care and behavioral health service sites have been updated to reflect location changes, and a list of our community contractors is provided. Lastly, the report includes additional DPH resources, such as where to find more information on the Health Commission, where to get health coverage, and of course, San Francisco's COVID response. Next slide, please. Moving forward, we've already received some feedback that we're working on incorporating into the final report and presentation to the full Health Commission on May 2nd, and we welcome any additional feedback. At this time, Max and I are happy to take any questions or comments. Thank you so much for your time.
All right, commissioners, if you, would you mind if I checked with public comment? Person on the line, if you'd like to make public comment on this item, which is the draft DPH annual report, please press *3. *3. All right, looks like there's no public comment.
Great. I have a couple of questions and a comment. I just want to commend you for all of the data at the end of the report and how it was broken out. It was really very helpful to get a kind of data picture throughout the programs in the department. I just want to commend you for putting all of that together. It was helpful. One of the things that I thought would be helpful, though, for all of the highlighted programs is to have the number of people served. Many of the programs you do, but in certain programs like the MCH perinatal program that you gave that information, how many people were actually served in the program. The same with the diabetes program. I'm just throwing out a few that I saw. In the MAP program, I just think in many of the programs you do have the numbers, but if just in, reading it, I always like if you've got some in some programs, try to do it to all. So then, like for example, I am quite familiar with the perinatal program and the birthright program, et cetera. And it's like, okay, we've had some really innovative and model programs, but if somebody is asking me a question about it or whatever, I don't know, yes, I'll take everybody's word, how successful it was, et cetera. But I need to know, I'd like to know how many people were served in the program. So I guess my question or concern is consistency. As, let's say, an outsider reading it, it's like, okay, I know in X program how many people were seen in primary care, how many visits, et cetera. What about all the other highlighted programs that are excellent, but we need more data. I can see that sometimes in just DPH as we're reporting things in the media. I know in our last commission meeting when we were talking about care management, integrated care, we knew, numbers were presented, so it gave not only ourselves, but also the public an understanding of how many people DPH serves. I don't think it's always out there to most folks, and I just think even interdepartmentally, I think it would be really very helpful. But it's an excellent report. I'm just trying to, add to it, so to speak. I think would really be helpful.
Yes, thank you so much for that feedback. We'll definitely work with the DPH staff that we worked with on these highlights to incorporate that feedback. Thank you.
Because I know they're there. You know what I mean? So, because we've had individual reports from some of the programs that you're highlighting, and I know that you got the numbers, so
Thank you.
put it in there.
Commissioner Gerardo, may I ask a clarification question?
Sure.
Based on your comments, if, let's say, they're able to get all but one program kind of thing, would you prefer that they have a footnote or something regarding not being able to get data or something so at least there's explanation, or does that matter?
I think it does matter because, not just for me, but I think as we're trying to highlight in especially these financial times of, if somebody is picking this up, and using it for whatever, I just think it should be noted that they weren't available or they're being, I agree. There needs to be something kind of flagged that it doesn't look like we're asleep at the switch, put it that way.
Thank you.
Thank you. I agree with what Commissioner Gerardo said, and I just want to say, based on personal experience, the fact that those figures of the number of people served helps other departments, other department heads understand more specifically what DPH is doing with all that money DPH has, particularly, as Commissioner Gerardo said, in the atmosphere that we generally find ourselves in many years in a row, that departments are being asked to cut money that they need. And so I think it really does. The Department of Public Health is an amazing institution and, the backbone of the health and safety of our community. And so we know the work is being done, and people, if they think about it, understand. But looking at, the amount, the enormous budget that the department has, for good reason, people who are not familiar with the day-to-day work, it would help them to see how significant the impact is on individuals, people who live in our city or are visiting our city. But great work, and looking forward to the final report.
Thank you so much, Commissioner.
All right, I'd also like to know, I don't know how long you've been here, Michelle, but this is the first time I believe that you're presenting in front of the
Yes.
commission. So commissioners, if you would also welcome her in that regard, because that's a big deal and an important step in the time at DPH.
Welcome. In your first time out, you did a great job.
Oh, thank you so much. I really appreciate that.
Agreed.
All right.
Not easy.
So it seems like we're done with this item. Is that correct? All right, that was kind of easy peasy.
Thank
Good
you
for
so
Michelle.
much. Thank you.
And Ms. Pierce, I know your colleagues are maybe, I'm not sure if they're here yet. Is it possible to call them. Commissioners, that item was much quicker than what we'd anticipated, and the other two presenters aren't going to be coming for like another 10 or 15 minutes. Although we have one representative here. Ms. Pierce, if you can begin.
Presentation was short. Hello.
Do everything myself.
And then you look at the clock and run, right? Yeah, I know. We're going to take a pause, a recess between our items for the next wonderful staff to arrive.
Thank you.
We will now resume the meeting.
All right, so we move on to item 4, San Francisco Environmental Justice Framework.
Good afternoon, Commissioners. I'm Karen Pierce. I'm the Environmental Justice Director in the Population Health Division. And I have presented before, so don't have to welcome me. But there's 2 commissioners I've never met before, so I'm happy to meet you. And how are you, Commissioner? I'm going to just introduce the 2 presenters from City Planning, and then I'll have a few comments at the end of their presentation. Very short, okay? But I do want to say that I am so happy that we were invited to present this today, because the health department, through my office, was invited early on to collaborate and work in partnership with City Planning on developing this environmental justice framework that will apply to the whole city. And this is, as you know, our city has some difficulty with building collaborations among the departments, et cetera. This has been an incredibly successful collaboration. It was a collaboration that included a number of city departments and an incredible group of community members, residents and activists that'll all be introduced to you in the presentation. So I have with me today Lisa Chen and Danielle, blocked the last name, from the Department of City Planning, and they will present the framework. And if you haven't had a chance to review it, you'll see that the framework is basically a roadmap of public health issues.
Good afternoon, Commissioners. Can you hear me okay? Yeah. I'm Lisa Chen. I'm a principal planner with the Planning Department. And today we're going to be providing an informational presentation on the EJ framework. It's a proposed update to our city's general plan, which is our city's overarching policy document. It's basically our roadmap for how we're going to grow and develop as a city. And the framework is up for adoption at the Board of Supervisors later this month. And if it's adopted, it'll actually become the first citywide policy that's aimed at addressing environmental justice across all city agencies. I'm going to hand it over shortly to Danielle No to give the presentation, but just also wanted to emphasize our gratitude to the Commission today for hearing this and for your input. but then also along the lines of Karen, really acknowledging the many community members. So community-based organizations, we partnered with some schools, many community members over the past couple years of outreach. They really, they challenged us, which is a great thing. They challenged us to really think about equity and environmental justice and to center it in this work. And we really would not be here without them. And then also reiterating Karen's acknowledgement of collaboration. And we've just been so pleased with this collaboration with DPH. We have a slide later that's going to name other staff. But in particular, we really want to acknowledge and thank Karen for all of her mentorship and guidance throughout this process. And we really see this as the first step. We hope that there will be other continued opportunities to collaborate on making the city a more sustainable, more equitable, and healthy place. So I'll pass it to Danielle now.
Thanks, Lisa. All right, waiting for the amplification. That's good. Okay.
It comes and goes.
Okay, thank you. So hi, I'm Danielle Ngo. I'm a senior planner with the department, and so I should be able to advance the slides.
Oh,
here?
no, I'll do it for
Okay,
you.
Thank you. Thanks, Mark. So we'll start with the background and goals, share more about our process, and then the piece de resistance is the framework itself. Next slide, please.
Could you just speak a little bit more into the microphone, or maybe?
How about now?
Yeah, that would, thank you.
Got it. Thank you. Okay. So in addition to Karen Pierce, we also wanted to appreciate collaboration from Matt Wolf and Karen Yu. The Department of Public Health was a key partner in this work, as well as SF Environment and the SFPUC. And so as Karen and Lisa mentioned, this interagency collaboration was challenging, but also extremely rewarding, and we hope can continue to grow as this work continues. Next slide, please. So the general plan is the citywide policy document which we're seeking to amend. The general plan is mandated by state law, and as a rule, the policies in the general plan are meant to guide city action for at least a 20-year perspective. There are 10 different chapters or elements that cover a lot of topics of how people live and work and enjoy the city. So you may have heard of the housing element. There's also the transportation element, the safety and resilience element, and other chapters that address these long-range citywide policies. Next slide, please. This work is responding to state law, SB 1000, that requires us to incorporate policies in the general plan to address the unique and compounded health risks of environmental pollution exposure as well as social vulnerabilities. And so there's two prongs of SB 1000. One is to analyze data on environmental justice communities, and two is adding the policies that are specific to environmental justice into our general plan. And at the local level, we're responding to resolutions from our Planning Commission and Historic Preservation Commission that call on us to put policies with specific benefit with the American Indian community, the Black community, and other communities of color. Next slide, please. So one important step of this work is establishing a citywide definition of environmental justice. I won't read it in full, but these two sentences on the slide are our working definition. It was informed by a lot of community outreach and engagement and research in the environmental justice movement that has been active in the city for many, many decades. Notably, I do want to highlight the second part about how government should be fostering environmental justice opportunities through processes that repair past harms and acknowledge them, as well as enabling proactive community-led solutions for the future. Next slide. Thank you. And then to be more detailed about the scope of environmental justice policies, it starts with eliminating environmental pollution exposure and thinks more holistically about healthy communities and public health. And so inside the environmental justice framework, you can see policies that relate to physical activity, healthy food access, safe, healthy, and affordable homes, equitable and green jobs, as well as empowered neighborhoods. And so this broad scope of work is really guided by state law, and it's been highly encouraged in our community outreach to think expansively about healthy communities. Next slide, please. So these next couple slides will share about our robust process to engage the community. Next slide. So at a high level, we had many goals in our outreach that we conducted for over 2 years. We really wanted to meaningfully involve the community in local decision making. And so all of our outreach activities were designed to reach the residents, workers, and community leaders that are part of the areas of the city most impacted by environmental justice. We also wanted to elevate these issues to a citywide dialogue across neighborhood boundaries and acknowledge the past harms and identify solutions where the city and all city agencies can step in. And on the right-hand side, you can see some of the screenshots from our virtual events. The resolution is a little hard, but there are a number of city staff present in the tiles, as well as community leaders from the environmental justice communities. Next slide. And so we're really proud of the relationships we've built with a lot of community-based organizations throughout the city. This is just some of the activities we did. And so with youth engagement, with people as young as 2nd grade at Malcolm X Academy, to people as old as the undergraduates at SF State University. We also had a series of focus groups and a 8-month working group where we brought together city staff and community leaders to develop these policy recommendations together. And so throughout this 2-year effort for outreach and engagement, we heard a lot of feedback about people's living and working conditions. And we're really grateful for people to have shared such honest commentary so that we can translate into citywide policy. Thanks, next slide. And so now we'll transition to the Environmental Justice Communities Map, which is included in the framework. Next, thank you. And so SB 1000 cites CalEnviroScreen as a starting place to identify areas that are disproportionately burdened by environmental justice. CalEnviroScreen is a statewide map that has 20 indicators with pollution, health, and socioeconomic indicators, and it's used to determine the distribution of cap-and-trade funding. Notably, there's policy advocates and community advocates that critique CalEnviroScreen for excluding sensitive neighborhoods in the city. And so on the right-hand side, you can see CalEnviroScreen at the top, and at the bottom, the disadvantaged communities are excerpted. And so you can see Treasure Island, Soma, Tenderloin, and the Bayview. And so our work sought to expand CalEnviroScreen with an analysis specific to our city. And so we refined the methods with adding local data on top and having an easily replicable analysis that is aligned with other maps that we see from our partner agencies like MTC, DPH, and Rec and Park. And so on the next few slides, we'll share more about that in detail. And so after reviewing over 100 data sets, we landed on this methodology where CalEnviroScreen is our base, and we added more data on household income, air pollution exposure, as well as various social economic variables. And so importantly, we added data about race, education, linguistic ability, and other details specific to our city that the state doesn't have at such a specific resolution. So on our next slide, you'll see the map that we are proposing, and this is our final environmental justice communities map. The areas in red represent the top 1/3 of census tracts that have cumulative environmental burden and social vulnerability. These are the areas that we're labeling as environmental justice communities, and these are the geographies where the policies in our framework guide action to start and to focus on and to target. These areas are often low-income communities and communities of color throughout our city. And you can see compared to the state map on the right-hand side, it is more inclusive, it's more expansive. And so we're pleased to share that in our 2 years of outreach, we received a lot of positive feedback from community leaders and city staff about how it confirms with our ground truthing and lifts environmental justice beyond neighborhood boundaries. Next slide. And so we also published a supplemental data portal, which is a series of story maps to show how numerous health and demographic data align with our definition of environmental justice communities. And so just in this example screenshot, it's a map of asthma in the city. And the data portal was created in partnership with SF State students. Thank you. Next slide. Okay, so now for this final section, diving into the framework itself. As Karen mentioned, we really encourage everyone to check out the framework in full. These next few slides will share one example policy from each of the topics that are outlined from SB 1000. And so hopefully you can see these themes of incorporating environmental justice and racial and social equity throughout our general plan. So for healthy and resilient environments, there's policies about investing in our public utility systems so that we can affirm the human right to water, power, and sewer. Next slide. For physical activity and healthy public facilities, there are policies to encourage movement and experience in the outdoors for both physical and mental health and connection to community and culture. And so this example policy is about offering diverse, inclusive, and flexible programming in our public facilities. Next slide. We have a section on healthy food access, and the example we excerpted is to fostering climate resilience and innovation in the food system from production, manufacturing, sale, and public health. Next section is about safe, healthy, and affordable homes. And this whole topic was developed in parallel with our housing element, so you can see a lot of mirroring policy ideas. The one we've excerpted here is about ensuring housing that supports public health, measuring things like indoor air pollution, mold exposure, that sort of thing. Next, we have a set of policies on equitable and green jobs. So fostering a robust network of work and entrepreneurship. Next slide is the last but not least topic on empowered communities. And here we wanted to highlight centering environmental justice efforts with our American Indian communities and with traditional ecological knowledge. Next few slides. So we wanted to wrap up with our next steps. Next slide, please. As mentioned, this is one major step for the city to incorporate environmental justice and racial and social equity into our general plan. We wouldn't have gotten to this point without collaboration with our interagency partners. We can't describe it all in full in just one presentation slide, but we did want to highlight many of our key partners, such as Department of Public Health, for working on us to coordinate with projects that you all are working on and thinking through our future work plan for the city to address environmental justice. And so as mentioned earlier, some agencies are already incorporating the environmental justice communities map into their work. As an example, the PUC has used the draft map as one criteria in distributing funding for green infrastructure. And so we're really heartened for our agencies to be collaborating with each other to tangibly direct resources and attention to these areas with disproportionate experiences in environmental justice. And so that is our final slide. I will pass back to Karen and then be happy to answer any Q&A from you all. Thank you.
Thank you, Lisa and Danielle. Adoption of this framework offers us the opportunity to deliver community-led and equity-driven public health. The process that was used, bringing in community at not the exact beginning, but very close to the beginning, and stepping back and allowing the community members to lead us in identifying the issues that needed to be addressed in this framework is shown here, and you can see how comprehensive it is. And Dr. Chow had a question, and I do want to point out on the map that Chinatown is identified as an environmental justice community on the map that was put together through the efforts of community members. Many of us for a very long time have been questioning why Chinatown never appears when we're talking about communities that have specific needs that are environmental justice needs. And there were a number of people in the working group that were aware of that and aware of their community. So just looking at the map alone is testament to the fact that having community step up and tell us what we need to be looking at and how we need to be addressing the issues that affect them most directly is the proper way to go. We have many opportunities now with this framework, which I'm sure will be adopted by the Board of Supervisors next week. We have many opportunities to take a look at how we can expand the work we do. All of the branches in population health have been trained in results-based accountability. And if you look at the process of RBA, it is an environmental justice process. You start with community. You add in the work that you are already doing, the work that you can do, and you look for the results. Is anybody better off? Okay. We are equipped and prepared, the staff, to do this kind of work. We need direction and some time in order to really apply it. But I am just so excited about this because it brings the other city agencies into this work that will really allow us to address the needs of our most vulnerable population. And with that, I thank you, and we're all available for questions.
I will check public comment, if that's okay. Folks on the line, if you'd like to make comment on this item, which is item 4, please press *3. Again, *3 to make public comment. I see no hands, commissioners.
So thank you for the presentation. So when Commissioner Christian and I were on the Human Rights Commissions, we have repeatedly been educated, with the environmental racism report, and there were a lot of community members coming in, to talk about that and trying to hold us accountable. And I think that Commissioner Christian would remember. And one of the most vocal voices, is Dr. Espanola Jackson, who passed away in a few years ago. So I think that this would make her smile to see that we are finally moving and have momentum of really correcting some of the concerns that they were articulated, especially for the Bayview residents. One of the things that I am curious about, because it's not necessarily listed in these slides, one of Dr. Jackson's key issue is about the shipyard, the Navy shipyard, the contaminations which included a lot of cancer-causing agents. So that's a development issue as well. So what are we doing about that?
So the shipyard is a huge part of the environmental justice concerns in the city. And at this point, the Navy is responsible for going back and doing another characterization of what is going on. And you may know that recently there was a grand jury report about the need for some consideration because sea level rise is going to flood the area that we are certain still has radiological contamination and a lot of other toxins that have not been characterized. But right now, the federal government is responsible for doing another survey and characterization of that. And hopefully that will happen quicker than anything else that they've ever done out there. Okay. I think the key for, I am a resident of Bayview Hunters Point and an activist out there. And I think the key point for us is that while that is a huge threat, the fact is there are a lot of other environmental justice impacts going on in that neighborhood as well as throughout the city. And it's easy to focus on the big one and overlook some of the smaller things. And this work really elevates everything to the same level so that the issues that we can work on, that we have resources to work on, can be brought forward. And while we wait to see what happens next on the shipyard, we can be addressing these other issues. Biggest issue in Bayview Hunters Point right now is flooding. And the work that we're doing in population health related to climate change is taking a look at that and trying to figure out what we're going to do to ensure that we keep people as healthy as possible while these other agencies are responsible for addressing the root cause.
Well, thank you for that. I just want to say I appreciate, your comment, especially about the Bayview residents. It's hard not to bring them up when I've been exposing to all these testimonies for 7 years before I moved to the health commission. So thank you.
Yeah, it's an ongoing threat. It's hard to have a conversation without mentioning it. But there are a lot of other issues that also need the attention. Yes, go ahead.
I also just wanted to add on to Karen's points, which were totally spot on, that as Danielle mentioned, the EJ framework was developed in parallel with the housing element. And so the great aspect of that is that this work that we had been doing around environmental justice was infused into the housing element that was adopted earlier this year. And because, in large part because of what we had heard around the shipyard and more broadly in the neighborhood, there are policies in the housing element that talk about how when we're building on lands that are environmentally sensitive, that we really need to upgrade our policies around working with community, around informing them, around kind of working with them around solutions, so that way we can learn from the lessons of the shipyard as well.
Thank you.
Thank you. I'm not sure if this is the first time we've met, but if it is, it's really wonderful to meet you and to hear about this excellent and really important work. So thank you for this report. Jumping off Commissioner Chung's comments and your response to them, I wonder whether there's, from your perspective as the experts giving this information to the community, whether there's space to drop a footnote about the Navy Yard, because every time I have a conversation with people who are not focused on, who don't live in the Bayview or otherwise are not focused on the federal nature of the problem, there's this questions like, what is the city doing about the Bayview and the Navy Yard, and why isn't the Public Health Commission addressing it? And if there's some way that, in the context of your expertise in presenting this stuff, to note that for people so that they can set that aside and not focus on why there's not something about the shipyard.
Thank you. I think your comments are spot on. One good opportunity of the environmental justice framework being the first citywide policy for environmental justice is that a lot of our outreach and engagement helps set some baselining and like benchmarking of the community experiences. And so in the full framework, there are portions in each of the topics that are almost like what we heard to give specific context to San Francisco, to our environmental justice communities of healthy food access experiences and environmental pollution exposure experiences, and what you're mentioning about sea level rise and flooding and other climate resilience challenges. And so we were able to mention things such as the shipyard, we're able to mention things such as the displacement with the freeway construction long ago. We were able to mention moments of urban renewal and the harms to the American Indian community, Japanese American community, etc. And so hopefully there's like bits and pieces in our introduction, in our context setting, and also our reporting out from our community outreach and engagement so that these high-level policies of the general plan can resonate across the specific actions throughout our city agencies.
Thank you. And my next question may be one for you, so you might want to stay right there for a minute. The slides aren't numbered, and so I can't give you, at least as far as I can see. Oh, actually, they are, maybe.
On the bottom right?
Maybe it's slide 18.
It's like, yeah, light gray. Sorry.
Physical activity in healthy public facilities. When you presented the slide, you said physical and mental health, which is one of the things I was thinking about, and wondering if there is a way to, I know because when people think about environmental justice, mental health doesn't necessarily come to most people, but certainly the impacts of lack of safe and healthy environment has enormous impact on mental health. And as we try to move away from separating physical health from mental health, I wonder if there's a way to note and speak about that connection and how important it is, from everything from the trauma that people experience in our neighborhoods and in our city to the illnesses that people experience, which are related to environmental factors. And so I just wonder if you can elaborate on how you were thinking about that.
This is can you hear me? Yeah, this is definitely something that did come up a lot. Throughout our outreach process, we really focused our conversations in letting people share the lived experiences as they were comfortable doing so. And we did hear from a range of the communities in the map that, they definitely see a connection between the physical aspects of health and the emotional and mental aspects of health. And so, I think that the framework does provide a basis for that. It is meant to be comprehensive, but also holistic. And so it really is talking about how, our health is grounded by not only the physical aspects of pollution and access to clean air and water and places to exercise and get healthy food. It does also talk about empowered neighborhoods and making sure that we have those social connections and bonds that really sustain us. And so we definitely think that there's a placeholder for it there, even if it's not, fully expanded on. And then the other element, we talked a little bit about this and have alluded to it with the housing element, but our next step, this is kind of the phase one of this work. The phase two is to embed the concepts of the EJ framework throughout our general plan. So we're going to be looking at, things like our urban design element, our arts and culture element, commerce and industry, other elements where I think there's other opportunities to incorporate kind of that framing around mental health and kind of social connection.
That's great, and I'd appreciate that. And I would just ask that you think about ways to highlight the connection between what we call physical health and mental health so that people understand the connection, because the things that people tend to speak most about in the city that they encounter on the streets and in neighborhoods and in schools is the erosion and degradation of mental health that is visible and experienced in a very negative way by everyone who is touched by it. So from my perspective, it would be useful to highlight that as a part of environmental justice. Thank you so much for the work and the report.
Thank you. I have a couple of questions too. One, since this is the first presentation since I've been on the commission, it's wonderful. And my understanding is you've got the policies that, let's say, you presented, and then the second document, which was the framework where it was much more specific, is where your goal is to take the policies into strategies that can be implemented. So as I am looking through the examples of the strategies that are highlighted in this part of the report, that there is only one reference under the Safe, Healthy, and Affordable Homes that highlights DPH, which was the Child Lead Poisoning Prevention Program. Just as within population health and the DPH presentation to our committee, there is no, and I know within the other areas, since we've had presentations, particularly on healthy food, but the department is not called out as a participant in, let's say, in the healthy food. There's only, as I went, unless I missed something, but I thought I went through the strategies and all of the different highlighted areas, that it would be helpful just for knowledge basis that we know where the department, and I'm sure it's within all of the areas, but that it is noted to us that in fact DPH is a real player in all the strategic areas.
So I think planning has a response to that as well. But I want to point out that this is a framework for the whole city, and specifics about what is going to happen are not in there for, I think, a very good reason. We're talking about environmental justice. So we're talking about having those most affected speak for themselves and lead. And this document opens the door for the department to take a look and say, here are our priorities. For you commissioners to say, here are our priorities. And let's go out and find the resources that are needed in order for us to address it. You know, this is our roadmap. This is not our report on what's been done. And that is the most exciting part of it for me.
Okay, that, I guess, is part of my second part of the question, is I guess I just oftentimes get frustrated within the city departments of all of these wonderful policies, but then I don't always see the translation into measurable strategies. So, and I understand exactly what you're talking about, but I guess my concern in scrolling forward and having environmental justice as a priority, unless we've got strategies from not just DPH, but any of the other departments that have measurable outcomes, I'm not going to see I don't think there's going to be a lot of true buy-in on a sustainability basis from whoever's heading whatever department that we're collaborating with, as, the revolving door sometimes is going on. So that's one of, I guess, my concerns is is the translation to the outcome data. And also, since DPH is the largest department in the city, and really within all of the areas, it's part of everything that, especially in the food, the healthy food, et cetera. I think we need to possibly call it out, and then if you can help me understand maybe a timeline of implementation to outcome data that can be looked at as policies, strategies, outcome.
Yeah, I'm happy to help clarify some of the structure and
Okay, that
our
would help me,
ideas for
yeah.
action, and then I'm sure Lisa can fill in any gaps that I missed. So the general plan has 10 of those chapters: housing, transportation, arts, et cetera, et cetera. But we consciously chose to have a framework that is in our general plan introduction and overarching to all of those topics. We didn't want to silo environmental justice into its own thing that is forgotten about on a shelf for many years. We wanted to have that opportunity and open door to connect environmental justice to transportation, environmental justice to commerce in industry, et cetera, et cetera. And this is the first time we're doing this, empowered by the state law. The other chapters throughout the general plan are updated on varying timelines. And so the housing element currently is the only element that's required to be updated every 8 years. And there's a lot of review and regulation and implementation monitoring activity. But for the environmental justice framework, actually the state law does not have that same requirement to update on a regular basis or have very detailed implementing actions for every single policy. We don't have that yet. This is a big first step to even have these citywide policies. And so I think that's why it's been really helpful for us over the past 2 years to do outreach, number one, with the community and to start with their voices, and also to do outreach with interagency partners like you all. Because while we've been tying environmental justice policies to all these other general plan elements, we're also having these conversations with the PUC and saying, your work ties to environmental justice. We're talking to MoCD and saying, your work ties to environmental justice. Public health, you all are, I'm preaching to the choir here. And so we are starting to build these relationships, grow these relationships with our city partners so that our phase 2, which Lisa mentioned earlier, can become stronger. So we're going to be putting these environmental justice policies throughout these other elements so that they become more specific and tie to city action. And then another thing to mention is the strategies that we list in the framework itself. Those are meant to celebrate prior work, ongoing work. It was not meant to be comprehensive. And so I think that's also just a demonstration of how we are socializing environmental justice efforts throughout the city and then doing that advocacy internally and externally to grow this work. And so we're going to the Board of Supervisors next week and the following weeks, and hopefully they will adopt our framework, and that will be a signal to harvest I don't know if harvest is the right word, but to advocate for resources throughout our agencies to keep up this work.
So within the Senate bill, just so my brain is computing, you don't need to, the Senate bill does not say, what the outcomes are. It is more it's more policies, strategies, and basically do your best within the framework, and each locale can do what they want, but the state's not requiring any outcome data. Let's say with transportation, that there's more hydrogen-fueled buses or something. I don't know, but I'm just saying, when we're looking at the San Francisco Green Connections, multiple city agencies, great, what are they doing? Things like that. It's not, you don't, it's not required, and so at this point, you don't need to do it, and you don't really have the resources.
If I could maybe just
Please
maybe
go.
make a slight shift in that statement. So as Daniel noted, the state has various requirements around the general plan. The housing element is the most kind of strictly controlled by the state. It has very rigorous reporting requirements. So, in this past housing element that was just adopted, there are 359 actions, and on an annual basis, we will be reporting on our progress. With the other elements, we do report to the state on an annual basis about our general plan as a whole and any activities that we've made, how we've responded to any changing mandates from the state. So, for example, in this upcoming report, which I think we just drafted and submitted this month, we've made mention of this process and how it complies with SB 1000. But, in terms of the actual monitoring of the outcomes, that is really left to the individual communities. I will say that the intention of the general plan is really to be our roadmap, or I like to think of it as our North Star, right? So if we're all, at least orienting ourselves towards that common goal, we will start to see actual changes happen. But we really do, to Danielle's point, really need to socialize these ideas. We've been really, really pleased by the interagency coordination. We've had, I believe, 10 or so different agencies who have come to our working group meetings, have worked directly with community members to co-create these ideas that are in this framework, and have now become champions for this work in their respective agencies. We also are encouraging people to link up with other internal work that's happening. So as one example, every agency is responsible for submitting a racial and social equity action plan. The phase 1 action plan, which was due, I believe, last year, that was really about internal to each department. And then the phase 2 is really how are you as agencies going to change racial and social equity outcomes in your community. And so I think there's a lot of opportunity to kind of use some of what came out of the EJ framework to help seed those plans as well. But we're always looking for more opportunities and would love if you have other ideas as well.
So I think that, like what the other two commissioners are saying, and I'm joining in, is that we want to be your cheerleaders, and, and we just want to also make sure that, it has the directions that's going to really benefit everybody. And now I want to my last questions, I'm channeling Commissioner Geraldo. A lot of times, when we talk about environmental justice, we really don't think a lot about neighborhood itself or community itself, and to add to Commissioner Christian's point about mental health. So that led to my curiosities around child development in these neighborhoods. And I know that there are a lot of youth centers and First Five in many of these vulnerable neighborhoods. Are there any research that we can follow to make sure that, we actually are doing things to address that particular issue?
I don't know. I can't refer to any research going on, and there probably is some. But the one thing that we have not really stressed, that we've overlooked, is that the groups and the individuals who were actively involved in the working group, once their work was over, decided to continue on their own. Everyone who participated was given a stipend for their time. And now they are continuing this because there is a commitment among these various groups to ensure that this is not another report that sits on the shelf, but in fact is going to be implemented, which again is another positive when you take an environmental justice approach to working on these issues. So there are folks out there who are paying attention, and I think all of them were very vocal. And I think that if we don't produce something you commissioners will be hearing about it. Again, the process is what I want to stress right now, because it has included a commitment for ongoing oversight by the community that is affected. And I just want to encourage us to realize the potential for developing new approaches to address some ongoing problems that the department has been attempting to address successfully for many years. You know, this adds another piece to our ability to address them.
Those new approaches are definitely needed, and I join you on that and celebrate that point, and we'll keep that in mind.
Yeah, and the kitchen sink of questions that we throw at you was really to show you how excited we are, with
Absolutely.
this framework. And, we look forward to the next time when you come and present, that there are some stories that you can also bring
Right.
to us too. We love stories.
Yeah, this is tremendously exciting. Thank you.
It is. And one of the areas, and Commissioner Chung just kind of raised it, when I'm looking at all of the different areas, is, we're already doing really good work in a lot of different places. And for example, we've got, I think it's 27 or 28 family resource centers that are funded by, First Five is in charge of it, plus it's funded by two others, HSA, et cetera. I mean, this would be real fertile data, et cetera, for you folks as well, because it touches every single area. And in the map, most of the family resource centers are located in the red zones or the orange zones, whatever, in the ones. So there is also things that are going on that could be even more of the strategies could be implemented, since I'm always looking for not reinventing wheels, but it's, like you said, First Five, and with kids and families that we're trying to keep in the city, we've got a system in place that, you could access to, so.
And I'm excited, the reference to mental health
Yes.
and incorporating that into everything, being articulated is very exciting as well. So thank you. We are, of course, very excited about the work, and I really appreciate all of your questions, and hope that we can come back soon and give you an update on what's happening.
Look forward to that.
Yes.
Thank you.
Thank you very much.
So much.
Great. We can move on to item 5, emerging issues. Anything from you all, commissioners, before we go to public comment? Okay, I'll see if anyone on the line would like to make comment. Thank you, by the way, again, presenters. Item 5 on emerging issues. Folks on the line, if you'd like to make comment, please press *3. All right, I don't see any hands, so we can move on to public comment. And folks, this is a time to make comment on an issue or item that's not on the agenda. Again, public comment, press *3 if you'd like to make a comment. All right, no hands, commissioners, so now we're at a consideration for adjournment.
So moved.
Second.
You all have to do a regular, all those in favor?
Aye.
Aye.
Okay,
Aye.
all those opposed? Great. All right, thank you so much. Thank
I'm
you,
gonna
members of the public,
oppose
for
one of
stopping
these
by.
days.